Why does casuistry risk moral decay in ethics? Have you ever wondered how ethical decisions are made in healthcare? Today, we will discuss casuistry and its potential risks in moral reasoning. Casuistry is a method that focuses on analyzing specific cases rather than applying universal moral principles. This approach can be helpful in complex healthcare situations, but it also poses risks of moral decay. At its core, casuistry examines particular circumstances and draws analogies between cases to guide ethical decisions. This method values practical judgment and acknowledges the complexity of real-world dilemmas. However, this flexibility can lead to inconsistent or overly relativistic judgments. When decision-makers prioritize case-specific details over consistent ethical standards, the integrity of moral norms may be compromised. In medical ethics, foundational principles include respect for autonomy, beneficence, non-maleficence, and justice. Casuistry's emphasis on context can sometimes overshadow these principles. For instance, focusing too narrowly on a single patient's unique situation might justify overriding general rules meant to protect vulnerable populations. This can create a slippery slope where exceptions become more common, gradually eroding established ethical standards. Moreover, casuistry relies on analogical reasoning and probabilistic judgments. This means that moral conclusions can vary significantly based on how cases are framed or which details are emphasized. Such variability can undermine the predictability and reliability of ethical guidance. When healthcare professionals cannot trust the consistency of ethical decision-making, it can lead to moral uncertainty and a loss of trust in the system. In practical terms, while casuistry helps navigate complex cases, like balancing a patient's beliefs against life-saving treatment, it requires careful safeguards. Grounding case analyses in established ethical principles is essential. Ensuring transparency in reasoning and maintaining accountability can prevent moral standards from being compromised. Casuistry risks moral decay because its flexible, case-specific approach can lead to inconsistent application of moral principles. This can result in the justification of ethically questionable decisions and the erosion of the stability of core ethical norms. To mitigate these risks, it is vital to balance casuistry with adherence to fundamental medical ethics principles. This balance provides a stable framework for moral judgment in healthcare today.